Hi, Miss Lane and my fellow classmates. My name is Brandon Taylor, and my disease is African trypanosomiasis or African sleeping sickness. African sleeping sickness was discovered in 1902. It is caused by two subspecies of Trypanosome brucei, Trypanosome brucei gambinase and Trypanosome brucei rhodinase. Trypanosome brucei gambinase is a parasite of cattle and sheep, and rhodinase is a reservoir of many livestock and wild animals. This disease is local in 36 sub-Saharan African countries. Gambinase is most common, and it is found in central and western parts of Africa, while rhodinase is found in eastern and southern parts of Africa. Gambinase is sometimes called Western African trypanosomiasis, and rhodinase is normally called East African trypanosomiasis. Virulence. Virulence has two major factors. They can both detect host environment and evading immune response. The main one is the shedding of the VSG protein coat. The shedding of the VSG protein coat causes overreaction of macrophages, and the macrophages release harmful chemicals known as TNFs, which causes organ lesions or anemia. Secondary virulent factors are cysteine peptides, which degrade protein substrates, and oligonucleotides, which degrade peptide hormones. Trypanosome brucei is able to avoid being phagocytized by glycoproteins. Switching mechanisms on the VSG is it sheds. There are several different signs and symptoms of Trypanosome brucei, but they depend on the stages that they're in. Trypanosome brucei has two stages: the hemolymphatic and the meningocephalic stage. Hemolymphatic is the initial stage or the first stage, and it causes a conker to form where the tsetse fly has bitten the person. You can see here on the picture where I have a 13-year-old boy. His leg was bit where the conker had developed where the tsetse fly had bit him. And then there's another conker on the neck of another boy, but that's during the first stage. This is the second stage. Signs of the first stage. Other signs of the first stage are trypanosomiasis, which are also known as skin lesions, fever, tachycardia, edema, or weight loss. Stage 2 are headaches. They are very persistent: daytime somnolence, nighttime insomnia, behavioral changes such as mood swings or depression, no appetite, wasting syndrome, severe weight loss, such as this picture right here. I don't know if you can really see it, but the boy is very skinny. He's lost a lot of weight. He looks sick and he's sleeping a lot. Seizures, those are most common in children though. Diagnosis. Although general laboratory studies may be helpful, a definitive diagnosis of African trypanosomiasis requires actual detection of trypanosomes, such as a blood smear, conker aspiration, bone marrow aspiration, lymph node aspiration, or a CSF assay. A CSF assay is done to measure the white blood count, proteins, and the antibody M in your blood in patients with positive serologies or symptoms. Other procedures may be taken, such as CT, MRI, or EEG. treatment. Most African countries, they don't have, most of the African countries that get this disease, they are poverty stricken. And they can't afford like drugs for treatment, though the CDC helps with this one specific drug that can help treat it. Drug treatment is used depending on the stage and the type of the disease. For rodents, for the first stage it uses sermon, and the second stage it uses milsaperidone. Giminids uses for the first stage pentamidine or sermon, and for the second stage milsaperidone or eflornithine. You see that Giminids has either or, but since the rodents, I guess it isn't as common as Giminids, so it doesn't have other drugs that can be used. Late stage treatment for the African trypanosome is combination therapy. That's the best treatment according to evidence-based practice. There isn't a vaccine available for African sleeping sickness, and in both early and late stages of African sleeping sickness symptoms, they usually resolve after treatment. Prevention. There are several ways you can prevent getting African sleeping sickness. Covering your arms with long sleeves, wearing pants, or applying insecticides before going out. And even if you don't want to wear long sleeves or pants, you can apply the insecticides all over your body, but a broad application could be harmful to like other people around you. And those are the references that I use. Thank y'all so much.